Good afternoon to those of you who've just joined. We were just giving people another maybe few seconds to join, but I guess as we're starting to see people coming in, and I don't want to go over time, why don't we get started? So welcome everybody to our Novo Nordisk Network for Healthy Populations virtual seminar series. As many of you know, my name is Lorraine Lipscomb. I'm the director of the Novo Nordisk Network for Healthy Populations at the University of Toronto. And it gives me great pleasure to host this seminar for you today. So before I begin, with our speaker, I'll start with a land acknowledgement. So we would like to acknowledge that the land on which the region of Peel operates, where the Novo Nordisk Network is situated, is part of the treaty lands and the territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land. In particular, we acknowledge the territory of the Anishinaabe, the Huron-Wendat, the Haudenosaunee, and the Ojibwe-Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have the opportunity to work on this land, and by doing so, give our respect to its first inhabitants. So, once again, welcome everybody, and thank you for attending today's joint rounds hosted by University of Toronto Network for Healthy Populations and the Banting and Best Diabetes Center. These are the joint clinical and population research in progress rounds where we have an opportunity for students and junior trainees and junior scientists to present to us their research that they're working on in progress, to get some feedback, to share their learnings, and for us to hear from all our great young trainees and scientists at University of Toronto. So it gives me great pleasure today to introduce for you the topic sugar-sweetened beverage taxes as a public health intervention to reduce diabetes and other metabolic syndromes, which is presented by Dr. Daniel Zaltz. And before I introduce you to Daniel and tell you a little bit about him, I just want to quickly review some housekeeping items. So first of all, we appreciate if our audience mutes themselves during today's presentation. There will be an opportunity for questions at the end of today's session, and we will be inviting questions both through the chat box or by using the raise hand function. If you have any questions during the event that you would like Dr. Zaltz to address at the end of the session, please just enter them in the chat box. I'll do my best to make sure that Dr. Zaltz can answer your questions. And please note, lastly, that today's session is being recorded, and we will make the recording available on the network's website if you'd like to see it again, and or if you'd like to share with others who couldn't make it today. So now I'd like to introduce our speaker for today. So Daniel Zaltz is a social and behavioral scientist, as well as a postdoctoral research fellow in the Labé Lab at the Department of Nutritional Sciences at the University of Toronto Temerity Faculty of Medicine. His research is currently funded by the Canadian Institutes of Health Research and as well the Banting and Best Diabetes Center, and focuses on food policies in Canada and globally designed to reduce population level free and added sugar consumption. Daniel was previously funded as a fellow of the U.S. National Institutes of Health Diabetes and Digestive Kidney Diseases, with training in clinical research as well as epidemiology, both in diabetes and endocrinology. So without further ado, I'm going to pass the microphone on to Dr. Zaltz, who will start his talk today. Please go ahead, Dr. Zaltz.
Thank you so much, Dr. Lipscomb. I really appreciate the introduction. So first of all, thank you so much to the Network for Healthy Populations and Banting and Best Diabetes Center for holding these seminars. And today, as Dr. Lipscomb said, I'll be talking about sugar-sweetened beverage taxes and some results from our evaluation of Canada's first and only SSB tax, which exists in Newfoundland and Labrador. So I'd first like to acknowledge funding that I receive as a fellow of the Canadian Institutes of Health Research and from Banting and Best Diabetes Center. And the research that I present today came from a project funded by Heart and Stroke of Canada, Canadian Cancer Society, CIHR Institute of Cancer, and Memorial University in Newfoundland. I have no further conflicts of interest to disclose, and I do not receive funding from the food or beverage industry. So if we're talking about SSBs, sugar-sweetened beverages, we need to come to terms with what that actually means. And as we'll discuss later on, there's not one definition of SSBs. They're often defined in context. The broadest definition is proffered by the World Health Organization, which is any beverage with free or added sugars. So the umbrella term is free sugars, and that's any mono or disaccharide we add to foods or beverages during the manufacturing or cooking process, including those that naturally occur in honeys and juice and syrups, etc. Now, added sugars are a smaller category within the free sugar umbrella, which is all those refined sugars, your table sugar or even high fructose corn syrup that we add, and does not include the naturally occurring sugars. So for today's presentation, when I say SSBs or sugar-sweetened beverages, unless otherwise specified, I'm referring to those just with added sugars. So your more, traditional SSBs, your pops and fruit juices and sports drinks and energy drinks. And so with that, I'm going to first talk about SSB consumption and population level health outcomes. I'll then talk about the theory, design, and impacts of SSB taxes. And then finally, I'll introduce some of our early research on Canada's first SSB tax in Newfoundland and Labrador. And so first, we need to talk about the health impacts of SSB consumption on the population, which are actually quite vast. So we know most recently from the most recent meta-analysis that there's a linear dose response between SSB consumption and weight gain and adiposity. For each additional SSB, adults are expected to have about a 0.4 kilogram per meter squared increase in their BMI, which sounds somewhat modest, but considering first that high consumers often take in many more than one SSB per day, and second, even slight shifts in population distributions of BMI can have impacts on morbidity and mortality. This relationship alone underscores the importance of reducing SSB consumption. Results from the Framingham Heart Study show that higher consumers of SSBs have a 52% increased odds of incident dyslipidemia. Results from the Framingham cohort, cohort, shows that high consumers had a 46% higher odds of incident prediabetes. We also know that there's about a 16% increase in the risk of coronary heart disease for each additional SSB consumed per day. And the most proximal health outcome, or one of the most, would be actually dental health. And high consumers of SSBs have about a 57% increased risk of dental caries or cavities compared to those who do not consume SSBs. Now, I'd like to highlight the importance of SSBs and its impact on type 2 diabetes. The highest consumers of SSBs have an estimated 26% increased risk of developing type 2 diabetes. And interestingly, the increased risk is independent of all the other, major risk factors that form the constellation of overall metabolic health risks. So, even once we control for dietary behaviors and health, when we control for BMI or weight gain, there remains an independent association between SSBs and incident type 2 diabetes, which should really underscore the importance of curtailing SSB consumption as a major public health goal in the 21st century. Now, the mechanisms to explain the impact of SSBs on human health are first somewhat intuitive. It leads to overconsumption. Your average can of pop can have upwards of 200 calories in it. So consuming SSBs is, of course, associated with excess caloric intake, and that energy imbalance in the body is long studied and known to create some of these chronic health conditions that I mentioned. What's actually happening is consumption of SSBs and the excess calories are altering what's called our typical compensatory reduction. Now, what that means is if you have a big lunch, you're probably going to have a smaller dinner. That's the way the body will, in one way, maintain its energy balance. But when you're getting the excess calories from a liquid source, there's one hypothesis that the liquid versus the solid source of calories is not going to create the same satiety cues in the brain and may cause overconsumption not only during your meal, but again at the next one. Interestingly, though, there's mechanisms beyond the calories that help explain SSB impact on health. And so we know that they create a high glycemic load in the body. They're associated with increased biomarkers of inflammation And we also know that the type of sweetener most often used here in Canada and in many other countries, high fructose corn syrup, has specific and independent effects on visceral adiposity and hepatic de novo lipogenesis. So now that we've sort of described or overviewed the impact of SSBs on health, let's look at what's going on here in Canada. So I'm showing the estimated mean daily intake of SSBs among all Canadians ages 1 year or older. This comes from the Canadian Community Health Survey, which was conducted in 2004, shown up here, and 2015, shown down here. On the y-axis, I'm showing you all the different provinces. I've additionally included Canada overall here in blue, and then Newfoundland and Labrador shown here in red. Now, two things should become apparent. First, as you can see, overall SSB consumption in Canada was higher in 2004 and was then reduced by 2015. As you can see, the overall trends here. In 2004, the average Canadian consumed about 275 milliliters of SSBs per day, and in 2015, just over 200. What you can also see is that SSB consumption in Newfoundland is consistently above the national average and among the highest of all provinces. Here I'm showing the combined prevalence of overweight and obesity, again by province, with the overall Canadian average shown here on the bottom. And as you can see from 2016 through 2022, the combined prevalence of overweight and obesity has been highest in Newfoundland and Labrador. Most recently, around 80% of those folks in Newfoundland and Labrador, ages 12 and older, had either overweight or obesity, compared to the national average of just under 65%. And here I'm showing the prevalence of diabetes from 2015 to 2022, again by province and shown here in blue, Canada-wide, with Newfoundland and Labrador highlighted in red. So a few things to note. The prevalence of diabetes in Canada from 2015 to 2022 has slightly increased from just under 7 to just under 8%. But as you can see, the prevalence in Newfoundland and Labrador is consistently among, if not the highest, and recent changes in its slope signal some potential alarming trends that do require public health interventions. I should mention these data do show combined prevalence of type 1 and type 2 diabetes, but we know that about 90 to 95% of these cases are indeed type 2 diabetes. We also know that each year, SSB consumption is associated with an increase of 25,000 incident cases of type 2 diabetes, which I think should further underscore the importance of reducing SSB consumption here in Canada to improve population level health, specifically as it relates to metabolic health and diabetes. And given that, and given the need for these interventions, I'd like now to shift to talking about how SSB taxes have emerged and where they fit into the variety of interventions that we have in public health to reduce their consumption. So as a public health scientist, I'm often thinking about SSB interventions across the socio-ecological model. And there are many that exist at the intra or interpersonal level, targeting individuals or smaller communities. And these are often more intense, targeted, and have specific short-term impacts. So I'm thinking about things like dietary counseling or parent education. It could be what your pediatrician tells you about feeding your child. Now, oftentimes those interventions, when evaluated, have pretty good results. They pretty much work in certain ways in the short term, but they're not very scalable or sustainable over the long term. So you cannot provide dietary counseling for years on end for millions of people consistently. And so their overall population level impacts are sometimes limited. On the other hand, you have your environmental, policy, and structural interventions that are often targeting the availability, affordability, and accessibility of certain foods and beverages. And these are often broader and cross-cutting. They have longer-term impacts because they take a while to manifest, but they're oftentimes more sustainable and scalable, and these policies are often affecting millions of people. And so SSB taxes have emerged as a very important and almost essential part of beverage policies globally, specifically at the upper levels, that environmental or policy level of the socio-ecological model. And now, simply put, their goal is to increase the price of SSBs to thereby reduce demand and eventually decrease consumption of the products. That decrease in consumption at a population level will therefore decrease free and added sugars in the diets. And that's because SSBs account for the majority of many people's added sugar intake. Now, even though that's the overall goal, there are so many different ways to design and implement SSB taxes. And the heterogeneity in these design features can impact their eventual public health impacts or lack thereof. Now, I'm happy to talk about more of this in the discussion. I'm just going to go through some of these design features to give you an idea of how many details are involved when we create these interventions and how they may impact the eventual effects of the tax. So first, we should consider, when are they calculated? A sales tax is something that you bring to the register, you're rung up, and there's an added tax right there. So that's the end user. But oftentimes these taxes are occurring earlier in the supply chain. So they may be levied against producers or wholesalers, distributors, or retailers. And those have differential impacts on their potential public health outcome. We also want to think about, how are they calculated? Sometimes we have taxes that are calculated based on the end user's price. So an ad valorem tax of 10%, 20%. And in that case, the more expensive products have a higher tax on them. In other places, SSBs are taxed based on volume. So you'd see something like 10, 15, 20 cents per liter of SSB. And then even yet, there's other ways to do it, like based on its sugar content. So in certain places, there are SSB taxes linked to the more sugary beverages. So the more sugar contained per, let's say, 100 milliliters or whatever, will have a higher tax than those beverages with lower amounts of sugar. Another design feature to consider is how these taxes are implemented. In certain cases, they're legislated, and in democratic societies, they may be brought to legislatures and voted on by lawmakers, or maybe used as ballot initiatives and voted on by the general public. But in other cases, governments use their abilities to collect money for their general funds, and they pass these taxes as budget measures, which don't necessarily require direct voting or legislation. And there's also the big question of, well, what is taxable versus not? And this goes back to what I originally said about SSBs are often defined in context. So each SSB tax that I have either evaluated or studied often has different ways of deciding what is or is not exempt from the tax. So many do not tax juice, but some do. Some even tax diet drinks, or those with non-nutritive sweeteners. Some don't, or most don't rather. And then finally, something to consider is, as the relative price of these SSBs changes, does the tax respond to these changes? Does the tax respond to inflation? And so as we think through these design features, it's important to know what the current state of SSB taxes are globally. So 105 countries have some type of national SSB tax. That underscores that these are no longer what I would consider emergent or new types of interventions. Rather, I think they're being shuttled into the central part of a suite of public health policies designed to improve population-level dietary health. They often do not apply to juice or sweetened milks. They're often not applied to the diet beverages either. They're most often levied at the producer or wholesaler level. So it's rarely the case that the SSB tax is actually applied at the cash register. More often than not, it's applied earlier in the supply chain with the goal that, let's say, the wholesaler then increases their price to the retailer, who increases the price to the consumer to recoup the added cost of the tax. Half of them are based on the actual unit cost to the consumer, or ad valorem. The other half are mixed. A lot of them are based on volume, so a certain number of cents per liter, let's say, and only a few are indexed to inflation. Now, overall, around the world, SSB taxes on average increase the price of a typical can of pop by about 3.5%. There had been a recent meta-analysis on the economic impacts of SSB taxes. We are seeing some evidence of what's called tax undershifting. And what that means is the total cost of the tax is not fully reflected in the increased cost to the consumer. However, we do see changes in demand. And on average, SSB taxes are reducing demand for SSBs by up to 15%. This is also reflected in an average price elasticity of about 1.6. So these are elastic products. As we raise their prices, we do expect their demand to decrease. A lot of opponents of these policies will often talk about potential changes or decreases in employment in businesses and for-profit sectors that deal with SSBs. But all of the research on this has shown actually negligible, if any, impacts to those sectors in the middle and long term. And then finally, there's some thoughts that it may impact total retail sales of the retailers who make money off of selling SSBs as well. But when implemented at national levels across broader geographic regions, there are negligible, if any, impacts on these retail sales. Now, of course, the question is, what are their impacts on health? And it's difficult to say because A, there's not enough data over a long period of time in many of these jurisdictions to actually measure things like changes in BMI or other metabolic outcomes. But we do have enough data to project population level impacts based on what we know about reductions in consumption. Said differently, it's much easier in the shorter term to measure changes in population level consumption than it is their changes in things like BMI. But using these consumption data, we can run simulations to sort of suggest what the longer term impacts will be. Now in Canada, for one type of tax, a 20% ad valorem tax, it's expected that such a tax would reduce the estimated yearly incidence of type 2 diabetes by 5,700 cases. More strikingly is a 1.5 cent per ounce tax on SSBs in Canada is expected in the first year to reduce cases of obesity by 120,000. Now, given this, in 2022, in response to the high levels of consumption and related chronic diseases, Newfoundland and Labrador implemented Canada's first and only SSB tax. And in this part of the presentation, I'd like to present some of our early research on this topic. Just a quick spoiler alert, I do not have the juicy post-tax evaluation of what actually happened. We're currently analyzing those data, but they're not quite ready for prime time. But sit tight and please get in touch with me because those will be ready quite soon. What I'd like to introduce first is what actually happened in the province. So this tax was implemented by the Department of Finance as part of their annual budget plan. So it was not legislated, it was just introduced into the budget. It became effective on September 1 of 2022, and it's a volume-based excise tax collected at the wholesale level. So again, if you think about those design features, it's based on the volume. They specify which SSBs are exempt and which are not, and then they're taxed at 20 cents per liter at the wholesaler, who then is expected to raise their prices to retailers and eventually consumers. The legislation applies to your regular pops or sodas, sweetened juice drinks, iced teas, lemonades, sports and energy drinks, and their related concentrates and powders. But it does not apply to 100% fruit juice, nor syrups or those beverages prepared at the point of service. This is your Frappuccino. It does not apply to alcohol or chocolate and sweetened milks or plant-based alternatives or yogurt beverages. So we know that SSB consumption is high in the province, but we also know that the most detailed data is from 2015. We also know that to evaluate the impact of the tax, we need to have a robust understanding of the baseline or pre-tax consumption levels. Said differently, you need to know where you were to know where you're going. And then finally, assessing the social and demographic beverage consumption patterns is crucial to better evaluate the health equity impacts of SSB taxes. What that means is as follows. We know that different groups of people, based on a variety of characteristics, consume SSBs and different types of SSBs differently. We also know that these SSB taxes may have impacts on these different groups of people in ways that could impact health equity. So understanding these the socially patterned consumption rates or patterns is an important piece of our evaluation. And therefore, the purpose of the study that I will describe was to describe these patterns of beverage consumption among adults in Newfoundland and Labrador prior to the implementation of an SSB tax. The study was run out of Memorial University of Newfoundland. It was among a cross-sectional convenient sample of adults ages 18 years and older who lived in the province in the period leading up to the tax, who were recruited via social media, email, and a commercial panel. Participants in the study reported their age, their sex at birth, gender, education, and then they also reported their occupation status. They reported their annual household income, which we mapped to the 2022 market basket measure for reference families in the province, and then categorized people as either living above or below the poverty threshold. People reported if they had children in the home, their race and ethnicity. They responded to a validated household food security questionnaire, and we took those answers and were able to categorize folks as either experiencing food security or not experiencing food security, or food insecurity, if you will. And then finally, people reported their height and weight, which we converted to BMI and thereafter into weight categories of either having overweight or obesity or not. Additionally, participants responded to a beverage frequency questionnaire. And this was previously actually created and validated and tested for reliability in similar samples across Canada. And what the beverage frequency questionnaire does is, for a whole litany of beverages, asks first, in the past 7 days, how often did you consume this beverage? And then if you did consume it, well, how much did you usually consume? And for that question, people would get, cups or mugs or bottles with lines on them, and they would just show pictorially around how much they would typically consume. And on our end, we were able to convert that to milliliters. So we asked these questions each for a whole bunch of different beverages shown here, which have also categorized based on their overall general category. And for the sake of today's presentation, I'll be talking about the SSBs, those that are taxable under the Newfoundland and Labrador law, and those that were made exempt under the law. And so in the first part of the study, I simply describe the characteristics of our sample. I then describe the prevalence and weekly mean consumption amounts of the SSBs, both categorized as the exempt or not, and then individually. And so what you can see here is our final study sample was of 1,233 adults living in the province. There's a nice split across the different age groups. We did oversample females. The sample is 65% female. The majority of our sample has education beyond post-secondary. About 60% were currently working. 2/3 were living above the poverty threshold. 60% reported experiencing food security. Most did not have children in the home. The vast majority were white, which does reflect overall the racial and ethnic makeup of the province. And then finally, about 72% reported having overweight or obesity. Here I'm showing you the actual consumption across the sample. And as you can see here, more than half of the sample reported regular weekly consumption of taxable SSBs in the time immediately preceding the new tax. So this column right here is a proportion. And it shows for each beverage or beverage category, how many people indicated that, yes, they consumed it, regardless of the amount, in the last week. And as you can see, more than half were consuming the taxable SSBs each week, of which it was mostly your regular sodas or pops. On the other hand, an even higher proportion, almost 2/3, were reporting regular weekly consumption of the SSBs that were not going to be taxed in the first place. And this is mostly your sweetened coffees and specialty coffee drinks. Now, among those who did report consumption, they were taking in about 2.6 liters of taxable SSBs per week and 3.8 liters of the non-taxable SSBs. So overall, folks who were consuming SSBs at all were taking in about 6.5 liters every week. And this was mostly the non-taxable SSBs compared to the taxable ones. Now that I described the overall sample and what their overall consumption was, my next goal was to describe the associations between selected sociodemographic characteristics and their consumption of different beverages. And so to do so, I fit two-part hurdle regression models. Now, SSBs are episodically consumed. And what that means is if you just sample a group of people and ask them about their SSB consumption, you'll often get a few folks, or quite a few rather, who will say, no, they didn't consume any in the last week. And there are people who just don't consume them at all. And what those data end up looking like are oftentimes inflated with these zeros. And those zeros in your data can have major impacts on your estimates and your variances. And it's important in nutritional epidemiology to match your analyses to the processes through which your data arises. And so for the sake of SSBs, you want to be able to both look at the prevalence, that is, how many people said yes versus no to consuming, and then the conditional mean, which is if you did say you consumed it, how much did you consume? And so what this two-part model does, and I'll show you here graphically, is this is what the actual distribution of weekly consumption of the taxable SSBs looked like in our data. And shown in blue here is these are all the folks who said, nope, I do not consume SSBs in the last week, and I likely don't consume them, on a weekly basis. These folks here in green are all the ones who said, yes, I consume them, and here's how much I consumed. Now, if we zoom in on just that semi-continuous portion, you can see we have a right skewed distribution. And this follows what we typically see in the data, where those who do consume SSBs, a lot of them consume just a little bit, and then fewer and fewer people are the higher consumers of the SSBs. And so what this two-part model does is at the same time, it estimates the log odds of any consumption, and then the conditional mean of how much was consumed, assuming you did have any consumption. I'm going to take you through the results slowly because there's a lot of information here, and then we'll move forward with other slides of other sociodemographics and SSB consumption. So here we're looking at the estimates from these models for age, and we're looking at estimates for both the models of taxable beverages, shown in red, and non-taxable beverages, shown in blue. The left side panel right here is the predicted probability of any weekly consumption. So these numbers here reflect, within groups, what their probability was of reporting any consumption of those beverages. Now, on the right side, what we're seeing is the estimated mean weekly consumption. And this answers, well, if you did consume the beverages, on average, how much were you consuming? And so what you can see here is as age increases, we have the younger folks here, older folks up here. And as age increases, you can see these red estimates, the taxable beverages, the likelihood of consumption goes down. So as you get older, your probability of consuming SSBs that were going to be taxed goes down. On the other hand, as you get older, you could see the mean amount of non-taxable SSBs is increasing. So we do see some patterns here by age. Now, moving on, we're looking at differences by male versus female. And as you can see here, males consume more taxable SSBs compared to females. Males are taking in over 3 liters per week on average, females about 2.5. You can also see that females have a higher preference for the non-taxable SSBs. And that's reflected in the distance between their estimates of the taxable and non-taxable SSBs compared to males here. Said differently, males are consuming a lot of SSBs, whether they were going to be taxed or not. Females also had high consumption, but a higher probability of consuming those that were never going to be taxed in the first place. Here we're looking at differences by education. And as you can see here, people with fewer years of education had a higher consumption of the taxable SSBs. As you can see right here, there almost appears to be a linear relation here between education, years of education, and the mean amount of taxable SSB consumption. That does not appear to be the case for the exempt or non-taxable beverages. Here we're looking at differences by employment status, and there does not appear to be an association between employment status and SSB consumption in Newfoundland and Labrador. And here's how I sort of conclude that. You can obviously see there's always a preference in our population for the non-taxable SSBs. But when comparing panels up and down, you can see that these estimates and these look pretty similar, as do these and these. So there does not appear to be group-wise differences in those estimates by employment status. However, when we look at annual income, there does appear to be a relationship. So reporting household annual income above the poverty level is associated with a lower consumption of taxable SSBs, shown here versus here. So folks here are getting 3.5 liters, and down here under 2.5 liters of the taxable SSBs. We also see a slightly higher preference for the non-taxable SSBs among folks who make more money. Here we're looking at the impact of food security, and again, it's collinear with income. And what we do see is experiencing food security is associated with a lower consumption of taxable SSBs. Said differently, those who did not experience food security were consuming more SSBs. And finally, there does not appear to be an association between weight status and SSB consumption. Again, we see preferences for the non-taxable beverages, but when comparing panels up and down, we see that the estimates among those with overweight or obesity look quite similar to those without, both in the probabilities and in the mean amounts. And so in conclusion, first, prior to the new tax, we found that being younger, male, or from a household experiencing food insecurity was associated with the highest prevalence and the highest consumption of the taxable SSBs in Newfoundland and Labrador. On the other hand, prior to the new tax, having more education or being female was associated with a higher prevalence and consumption of the non-taxable or exempt SSBs. And in general, the takeaway message is that on average, adults in Newfoundland and Labrador who report higher consumption of the taxable SSBs, in general, have fewer years of education, in general earn lower household income, and are more likely to report experiencing food insecurity. Now, I have a few hypothesized pathways to explain these associations. We know from previous research in the province that communities with lower socioeconomic status have neighborhood food environments that are associated with less healthy foods. And we know that socioeconomic status is in general associated with inequitable access to healthier, affordable food and beverage options. That has been directly linked to increased SSB consumption in Newfoundland and Labrador. And I think that may help explain some of the associations that we found. In many places in Newfoundland and Labrador, there is sometimes unreliable drinking water. And in certain places, and in 15% of our population during the study, there were boil orders, which is where the government says, in order to safely consume the water coming out of your tap, you should boil the water. What may happen in that is folks may instead shift to the next cheapest beverage, which in many cases, unfortunately, are sugar-sweetened beverages. And then finally, we know that communities with lower socioeconomic status are disproportionately advertised to for less healthy foods and beverages, including and specifically SSBs. And we know here in Canada that exposure to SSB marketing is associated with increased consumption of the SSBs. So listen, this was a descriptive study, and its purpose was to generate rather than test hypotheses. But the results are helping inform our current post-tax evaluations by first, helping us theorize our causal diagrams, and then considering nonlinear relationships across certain sociodemographic characteristics. I think the results also highlight areas to potentially improve this policy and other similar ones that may be coming down the pike. One major takeaway is that SSB consumption in the province was skewed towards those SSBs that were never going to be impacted by the tax. And there's, of course, limitations as there are for all studies. We did oversample females, we undersampled non-white adults, and we're not entirely sure if the people in our study reflect the actual urban and rural split of the population in Newfoundland and Labrador. We also collected a convenient sample and may have, surveyed folks that had stronger pre-existing attitudes, knowledge, or beliefs about diet. And then finally, in nutritional epidemiology, particularly for surveillance studies like this, there's always an inherent measurement error in the way we collect and measure dietary intake. However, people tend to underreport their SSB consumption. So while that would probably introduce measurement error overall and probably increase our confidence intervals, I think it's possible that our actual point estimates may be somewhat conservative and perhaps underestimating the actual level of consumption in the province. So in conclusion, what we see in Newfoundland and Labrador for the social patterning of SSB consumption is similar to what we've seen in prior studies across Canada, which is to say folks with lower socioeconomic status in general tend to be higher consumers of certain SSBs. Now, in theory, I think this means that the tax in Newfoundland and Labrador may help reduce dietary health inequities by reducing consumption among groups of people who are at a higher risk of high levels of consumption. And finally, the potential impact of the tax may indeed be limited because, as I mentioned, it exempts several highly consumed SSBs in the province, and it may highlight areas for improvement moving forward. So thank you so much for your time and for listening. I'd first like to acknowledge the Newfoundland and Labrador evaluation team with principal investigators, Drs. Rachel Prowse and Scott Harding. I'd of course like to thank my wonderful advisor, Dr. Mary Labbe, and all of my colleagues in the Lab A lab. And then finally, all of the funders and collaborators who have made this research possible. Thank you so much for your time listening, and I look forward to your questions.
Thank you so much, Daniel. That was a really, really inspiring and well delivered presentation. Really great work. Congratulations on the work that you've done so far. I'm going to now open it up for questions. Just to remind people, if they have questions, they can either raise their hand using the raise hand function or put their question in the chat. But I'm going to start with our faculty advisor, Mary Labbé, if you want to launch the Q&A period, Dr. Labbé.
Hey, sure. Thank you very much, Lorraine. I'm going to ask you one question, Daniel, and you kind of alluded to it, but do you know if there's anything in your data set or any way you're going to be able to get any information about children and adolescents or the children and adolescents in those homes? Because I think there is quite a good body of evidence that, really children, particularly in adolescents, have very strong negative impacts with high SSB consumption. So will the data in Newfoundland be able to shed any light on that question about children?
No, thank you for that question, Dr. Levin. And it is true, there's actually a larger impact of some of these interventions on younger people because among children and adolescents, SSBs are oftentimes their leading source of added sugars in the diet. Whereas you get older, we tend to diversify our sources. We do have survey data on adolescents. We're not yet sure how viable those subsample sizes are to make specific within age group estimations. So I'm not exactly sure how detailed we'll be able to be in older versus younger people. But one thing we're trying to do as a proxy is look at differences in purchasing and consumption among families with children in the home. So while I might not be able to say what child A, B, or C particularly consumed, we will be able to look at what families with young children were purchasing.
Thanks, Daniel.
Does anyone else have questions for Daniel? While you're thinking about that, maybe I can ask you a question, Daniel. So I had a few questions, but I guess I'll start with maybe just directly related to your data. So were you surprised of the lack of relationship between the consumption and overweight obesity? And what might do you think be the reasons for that sort of lack of association?
Sure. So there's been mixed findings in the research previously, both in Canada and in other, higher income countries. So we do sometimes find differences with folks who have overweight or obesity, sometimes being less likely to consume these beverages. And we often think that that's probably mediated by people in studies being more, either trying to lose weight or thinking about their diet in different ways. What we did find, and these are not data I showed, but I'm happy to share, is the only difference by weight category was for the diet or non-nutritive sweetened beverages. And folks who had overweight or obesity were on average more likely to consume and consuming more of the non-nutritive sweeteners. So, was I surprised? I think so, just because it's always interesting to look at things by those categories. But we do have mixed data, and so I think it sort of fits into the current unknown of where these patterns may or may not arise from.
Yeah, and other thoughts I had were, maybe because a bit of a ceiling effect, because you had such a relatively higher prevalence of obesity that you might be missing some associations potentially within certain age groups or something like that. And maybe the other piece could be around the fact that it's cross-sectional, right? So it's harder to, yeah. Thanks for that. Beju, do you have a question?
Yeah, thanks. Hi, Daniel. Sorry, I'm going to leave my video off because I'm having lunch with my non-sweetened beverage. So I just wanted to ask, do you have a sense of what is the sort of current landscape on, sugar-sweetened beverage taxes in Canada? I mean, you've given the example of Newfoundland where it's already in place, but what about in other provinces or at the federal level? And I'm just thinking, we're entering an era where affordability is the big political watchword, and so I would imagine there's probably a bit of an aversion to any kind of new taxes for any reason. But I'm just wondering if that is maybe not the case.
I think you're spot on. No person running for office uses an increase in tax as their central platform. And oftentimes when we see legislated taxes, that is things that are brought to votes, they're usually not used as at the start of terms. They're usually used when the candidate or the person has a ton of political sort of wind in their sails. So I don't so for that reason alone, and coming up to a federal election, I don't think that there's going to be a federal SSB tax in the very near future. However, what I can say is when you see regional differences in SSB taxes, the North American context is always underrepresented in those who have SSB taxes. But Canada has shown, at least in Newfoundland and Labrador, some real political will to pass this. So I'm wondering if perhaps we find some ways to move that forward with our advocacy partners. But no, I think in the near future, that might be a tough sell.
And what about in the US?
The US has plenty of SSB taxes at smaller levels, at state or even city levels. And they have defederalized a lot of their nutrition policies for public health. So I think in the US, you're going to see an increase in smaller places doing these things, and it's going to contribute to better understanding what's going on. Federally speaking, no, I don't think we're going to see a federal SSB tax in the US anytime soon. But eventually, I think what will happen is you'll see more and more regions coming along and linking these city centers that have them.
Right. Thanks.
Yeah, no, that's a really good question, Beju, and I'm actually thinking about the national diabetes strategy, where that they've put forward, and they're still trying to figure out what are the different kind of levers and components of that strategy. But as you point out, taxes are not the most popular incentives. So, Chris.
Thank you. Daniel, I'm curious to know if sample respondents, when you ask about sugar-sweetened beverages, do you want them to make a distinction, or are they able to make a distinction between like the new soft drink products that are called zero, often something zero, Pepsi Zero, Coke Zero, and like other beverages? So when you're talking about, so do some people think of those as sugar sweetened, even though they're not actually using sugar for sweetness? Is it important to make that distinction for the sample respondents so that's clear to them that you're talking about, like standard sugar sweetened beverages and the newer versions that are called zero?
Sure. No, it's a really important question. And I think when you're surveying dietary intake behaviors, you need to make sure that you have questions that are written at basic reading levels with plain knowledge and plain terms. We never once used the term sugar-sweetened beverage in our surveys. Even in a room full of scientists, we don't always agree on what SSB means. So when they actually see the survey for each beverage, we tell them, how often have you consumed a regular pop? And then we have a whole list of, this includes Coca-Cola, Pepsi, ginger ale, blah, 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 and does not include Coke Zero, Pepsi Zero, whatever else. So for each question, and this has been validated in prior populations, we're really being very clear on what beverages we are or are not talking about.
I see. Okay, thanks.
Thanks, Daniel. That's helpful to understand kind of how these questions were asked. Gazelle, you had your hand up.
Hi, sorry, just turning on my video. Hi, Daniel. I really love this topic a lot. I think there's just been so much momentum in recent years about SSBs, particularly with the findings that emerged from Mexico. And what I was curious, I know this is descriptive work that you've done, and it's hypothesis generating in so many ways. I was curious to know what are your next steps with some of the studies that have been modeled from Mexico, where they've actually gone into surveying specific population settings, as well as like low-income communities. I think there were some findings about how SSBs impacted low-income households. Apologies, I don't have the summaries in my hand. But I wondered if you perhaps took that angle that would provide a health equity lens to see the populations that we were seeing that are overrepresented when it comes to elevated BMI, obesity, diabetes, chronic diseases. Perhaps honing in those communities where we know that they are consuming unhealthy food options, drink options in this case. I wondered if you were planning to get into that and if you have findings around that as well.
I think really important topic. So yeah, this is all hypothesis generating. What we're doing is we're collecting data on beverage sales. So using consumer data on what sales were going on, and we'll be able to, for certain beverages, actually nail down to certain demographic characteristics, including income, neighborhood, food environment scores. And so we'll be able to look at overall consumption, or sorry, overall purchases based on a lot of those social and demographic characteristics you mentioned. We also have a subsample with whom we're doing 24-hour recalls. So we're going to be able to much more detailed ways look at consumption. And in those, we are sampling across many of the social categories I just mentioned. We're also looking and having researchers go into actual retail stores and actually purchase these beverages and collect receipts and geotag those receipts so we can look at how these prices are changing in real time in different areas. So the major way we've incorporated the health equity lens into our research is from a geospatial perspective of how food environments are oftentimes contained within these network buffers. And so we're looking at it in different types of networks.
Thank you. That's great. And Gazelle just added convenience store barcode data. Would that be something you could use?
We could. The majority of our data that we're actually collecting in person are receipts, and then we do have barcode and nutrition labels of the specific products that we are buying. We also have online purchases that we are able to do with those data as well.
Great. Thank you.
Thank you.
Dr. LeBay, you have your hand up.
Thanks. And I wasn't sure if I could ask a second question or not, but
Please.
I thought this is a question you might want to talk about, and if it follows on to your question, Lorraine. It's this whole question of like governments now being, tax averse. But I think there's one thing also going on in this sort of current climate, post-inflation, post-COVID, or during inflation, because some countries are still living with high inflation, and governments are desperate for what I would call revenue sources. And I mean, in some sense, could you talk about, do you know anything about how much revenue this actually contributed to the budget of the government of Newfoundland? And I also thought, like, the UK, to kind of get away from using the tax, they called it like a manufacturer's sugar levy. So they were kind of sort of almost put it at the level of the manufacturers. They weren't talking about it being consumer tax. I'm just wondering if you can sort of give us a bit of information of the thinking of it. And Mexico also did it. People said, some of these ones that aren't well designed sometimes were done because the governments were looking for tax revenue sources. And, if you're going to go down a tax revenue source, maybe at least design it to get the best public health bang for your buck. And I'm wondering if you could talk about this sort of as a strategy about how much money it actually contributes to government revenues for any of the taxes that have been out there that you may know.
Yeah, and thank you for that question. This is a very important topic. So the government of Newfoundland and Labrador projected an estimated $9 million of revenue from the first year of this tax. And I don't know the exact figure, but they made several $1 million more than that. So perhaps somewhere around $11 million on that tax. From one hand, from a finance point of view, they raised more money for their general budget. But from a public health intervention point of view, that means there's more consumption than they anticipated. To your other point about messaging is super important. And the way that the folks in the UK did it about a sugar levy can influence public opinion for sure. An important way to think about what this does economically is not just raising money, but also where that money is going. And so the big question is, do we put that into a general budget, or do we reinvest it specifically into health promotion, specifically among communities who need it most? There seems to be a general aversion to that here in Canada, so as not to sort of tie the hands of the next person up in the executive seat. But from a public health perspective, and in a lot of places, these revenue have been earmarked to improve health and health environments for people with lower socioeconomic status. And I think that would be a good way to sort of improve the public health benefit of these policies.
Yeah, that's really interesting. And, you know, this whole sort of messaging issue reminds us, of course, the elephant in the room is the whole anti-smoking campaign, and that, you know, and that kind of changed through the multi-pronged campaign, changed public attitude towards cigarette smoking, and therefore now, you know, targeted the big bad tobacco industry as the bad guys that should be paying for taxes if they want to be continuing to market this product out to the public. And so the public obviously sees this as more palatable, because, you know, you're asking the big bad companies to pay extra to be able to market to them. So this could be sort of, we're maybe still early in that kind of messaging awareness sort of shift in people's attitudes towards sugar-sweetened beverages. But as more of the public more and more become aware of this being unhealthy and something that shouldn't be marketed to them, perhaps could start to shift that landscape and make it look less like a tax on the consumer and more like a tax on the companies who want to continue to sell it and market it. I don't know if you have any further thoughts on that. I just a thought.
Well said. I agree.
Yeah. So we only have 3 minutes, and there is a question in the chat that I'll read out to you. Thank you for your presentation. Is there discussion in the research regarding how such taxes could potentially exacerbate health inequities by creating higher beverage costs for those of low income, i.e. requiring those experiencing lower income to spend more on an SSB beverage, which might displace money that can be spent on other food or household items?
It's an important topic, and it comes up every time I talk about SSB taxes. Well, aren't they just regressive? That's what people say. Well, these are regressive. People with less money will be sort of disproportionately punished. Now, when we actually study, so the answer is yes, there's research on this. When we study the regressivity of a tax, we don't just think about, well, in theory, people with less money are going to pay more money, relatively speaking. We think about how responsive are these folks to changes in prices. So if there are people with lower amounts of money and their product goes up in price, they may be quicker to reduce their consumption of that product. And this is how these interventions specifically target, in certain cases, folks with lower income. So when you actually look at the economic analyses, they are, of course, regressive in certain ways, but not to the extent that people think, especially when the cost the prices, the tax that's collected is reinvested in the communities. So over a broader view of not just increase in costs, but decrease in, let's say, healthcare costs and other productivity losses, we don't see the extent of regressivity that some folks think exists.
Well, that's thank you very much, Daniel, for that excellent response. And I think we're just about out of time. So I'm going to close the Q&A period and ask everybody to join me in thanking Daniel Zaltz for a wonderful, thought-provoking, and highly important presentation today. And we're looking forward to hearing more about your research as you continue to analyze the findings. And we also look forward to seeing how this this project that started in Newfoundland and Labrador could actually be scaled across the country in ways that might be more palatable to the public. So this is really great work. We wish you best of luck as you continue along this path, and we look forward to inviting you again to tell us about the next stage in this work. So thank you so much for giving us this snapshot today. And please, everyone, ensure that you complete today's evaluation for the session. Lydia's added the link in the chat pod, and this will be also sent by email. And now, before I close, I'd like to just remind everyone that our next Network for Healthy Populations seminar will be on Monday, April 8th at this time, 12 to 1 p.m. And we're so delighted that Dr. Blake Pollan from University of Toronto will be speaking to us on working with residents to affect change, a connected community approach. And you can go to our website to find out more and register for the event. So we hope to see you virtually all there. Thank you so much for joining, and I wish everyone a wonderful afternoon. And thanks again, Daniel.